Hello, welcome to part 32 of Clinical Physiotherapy MCQ series. Here we will be discussing day-to-day clinical scenarios with detailed explanation. Let's move to question number 156. An appropriate fine motor behavior that should be established by 9 months of age would be the ability to Option A. Build a tower of 4 blocks. Option B. Hold a cup by handle while drinking. Option C. Pick up a resin with a fine pincer grip. Option B. Transfer objects from one hand to the another. And the answer is Option B. Transfer objects from one hand to the another. Explanation to this question is transferring objects from one hand to the another is a task developmentally appropriate for 8 to 9 month old. Using a fine pincer grip and building a tower of 4 blocks are skills which develop later. Holding a cup by handle while drinking usually occurs by 12 months of age. Now let's move to question number 157. A physical therapist examines a patient with multiple sclerosis who is period of extubation. The patient is independent with bed mobility, can sit unassisted at the edge of the bed, and requires physical assistance to stand with a walker. Which of the following intervention would be the highest priority? Option A. Wheelchair propulsion up to 10 feet, 3-meter ramp. Option B. Wheelchair transfer. Option C. Walking with the assistive device. Option D. Tub transfer. And the answer is Option B. Wheelchair transfer. Explanation to this question is physical therapy intervention should focus on helping the patient obtain maximal functional independence. Wheelchair transfer are the means to be enable the patient to independently mobile and while be requirement before the more difficult tasks are performed, such as ascending a 10-foot ramp. The patient is presumably too weak to walk at this point in the time. Tub transfer are important, but that wheelchair will be the best means to beat patient to the tub. Therefore, for the initial innovation session, wheelchair transfer would be the most important. Now let's move to question number 158. A physical therapist is instructing a patient who has the left CVA and right lower extremity hemiparesis to use a cord cane. Which of the following is the most appropriate gait sequence? Option A. Place the cane in patient's left upper extremity. Encourage cane, then the left lower extremity, then left upper extremity gait sequence. Option B. Place the cane in patient's left upper extremity. Engage the cane, then the left lower extremity, then the right upper extremity gait sequence. Option C. Place the cane in the patient's right upper extremity. Engage the cane, then the right lower extremity, then left upper extremity gait sequence. Option D. Place the cane in patient's right upper extremity, engage the cane, then left lower extremity, then right upper extremity gait sequence. And the answer is Option A. Place the cane in the patient's left upper extremity, engage the cane, then right lower extremity, then left upper extremity gait sequence. Explanation to this question is the cane should be placed in the patient's strongest upper extremity and left arm or right foot to go together for normal gait. Now let's move to question number 159. The therapist is ordered to evaluate a patient in intensive care unit. The patient appears to be in coma and totally unresponsive to nauseous visual and auditory stimuli. What rating of Wranglo-Amgos scale cognitive functional scale is most appropriate? Option A 1, option B 3, option C 4, option D 6. And the answer is option D 6. Explanation to this question is 1 is response, 2 is generalized response, 3 is localized response, 4 is confused agitated, 5 is confused inappropriate, 6 is confused appropriate, 7 is atomic appropriate, 8 is purposeful appropriate. Now let's move to question number 160. During a cervical spine examination, you observe restricted left rotation of C7-T1 spinal level. After stabilizing the thoracic spine, your hand placement for mobilization to improve left rotation should be at option A, posterior left C6 articular pillar, option B, posterior left C7 articular pillar, option C, posterior right 7 articular pillar, option D, T1 spinous process. And the answer is option C, posterior right C7 articular pillar. Explanation to the question is, the most effective hand placement for mobilization in right-left rotation is at the right aspect of the right C7 articular pillar because it rotates the C7 vertebra to the left. So that's all for today. If you have any kind of doubt, please mention in the comment box. For further learning, keep in touch with the channel. See you in the next part, that's part 33. Bye bye, see you. Thank you for watching.